Children as young as 6 months old should be able to get their first dose of a COVID-19 vaccine by the middle of next week. As news specialist Jed Bull shows us, one of our state's top pediatricians recommends that parents talk with their kids' doctors about getting vaccinated.
Yeah, exactly. This is a eagerly awaited opportunity for many parents and their kids, and for others it's a very difficult decision. Dr. Andrew Pavia recommends that parents talk this decision over with their pediatrician or their family doctor.
So we expect the first doses to be available in Utah by the middle of the week.
Final approval from the CDC is expected soon for the Moderna and Pfizer vaccines for kids ages 6 months to 5 years.
This is really a big step. We've had several months now in which there's been a lot of disease out there, and younger children have not had any vaccine availability to provide them protection.
Dr. Andrew Pavia, Director of Epidemiology at Intermountain Primary Children's Hospital, says the vaccine will be given to pediatricians and family doctors so parents can get their kids vaccinated where they are comfortable.
For many parents, having the option to get your kids vaccinated is something that they've been eagerly waiting for. And it is, something that every parent has to decide for themselves.
Smaller doses than those given to adults, while side effects will be similar with the potential for swelling, fever, and flu-like symptoms.
COVID poses actually a much bigger risk to your child than any of the diseases that you routinely bring them in to get vaccinated for.
Early in the pandemic, children were not as heavily impacted by COVID. But last fall, the Delta variant sickened more kids, and Omicron hit the kids pretty hard. Not a lot of children die from COVID, but this summer, Pavia says, they have had anywhere from 6 to 12 kids hospitalized with COVID any given week.
The vaccines work at least as well as they do in adults.
Pavia again recommends that parents talk to their family doctors when they're making this decision. He says that he doesn't have kids in this age group, but if he did, he would make sure that he had them vaccinated because there is still a lot of infection circulating in the community.